Excellent. So again, welcome to What It Takes to Change Policy, Tobacco 21 Policy Evaluation, Results, and Lessons Learned. I'm so glad you're here. My name is Kelly Adcock, and I'm the Senior Director of Data and Learning at Interact for Health. So Interact for Health, just briefly about us, we're an independent foundation that works with communities to advance health justice so that we are ensuring that people across Greater Cincinnati are healthy and thriving regardless of who they are and where they live. We're committed to advancing health justice in the 20 counties you see here surrounding Greater Cincinnati. We know that our region lags behind our nation in how long and how well we live. And we know that some people in places lag even farther behind. So we work to improve the lives of those who experience the greatest health injustices by focusing on the people and communities you see here, those who are Black, Hispanic, children and families with low incomes, and our rural communities. To advance health justice, we make change happen through grants, learning, and partnerships focused on the 3 strategies you see here: improving mental health and well-being, amplifying community voices, and changing policies and systems to improve health, all sort of undergirded by our values, which are updated, newer to us, but very meaningful in all of the work that we do. So while the strategy you see here, we kicked this off officially at the beginning of 2023, but we've been supporting tobacco control efforts in the region over the past 5 years. It's great to see so many familiar faces on today that have been so critical to this work. It's not about Interact for Health, it's about supporting the region in advancing tobacco control. So we're excited to be on to share the story, the lessons learned, and the results of these efforts. Using Tobacco 21 really as a case study for reflecting on what it takes to change policy, and then imagining together of like what more we can do to advance and protect public policies that improve our health. After intros, we'll do a brief overview of policy and advocacy and the evaluation that was conducted, dive deep into a case study of 2 jurisdictions, the city of Cincinnati and Butler County, talking about their efforts and trials and tribulations and successes to advance Tobacco 21 here in the region. And then we'll move to talking about the impact of the policy, future implications for tobacco control policy, as well as other policy work that advances health. And then we'll have time at the end for Q&A. Many of the presenters will stick around. We've added sort of a 30-minute optional Q&A at the end. So if you have additional questions that we don't get to, we're happy to stay on at the end of the hour and continue chatting. All right, so who we're going to hear from today. In a moment, I'm going to invite the presenters here to introduce themselves. But while that's happening, I would love to hear from everyone else who's on the meeting today. So if you can pop into the chat and share your name, organization, and just one thing that's bringing you joy right now. So while we're doing that, I'm going to have presenters have you all introduce yourselves again. For presenters, yourselves, your organizations, maybe just very briefly what brings you to this topic today, and also one thing that brings you joy. So Kelly Adcock with Interact for Health. The data and learning and evaluation is what brings me to this, and specifically helping to spearhead the Tobacco 21 evaluation. And something bringing me joy right now are my 3 kids and all of our wonderful adventures. Dr. Amin, I'll turn it to you to introduce yourself.
Hi, good afternoon. Marie Amin, Assistant Health Commissioner with the City of Cincinnati Health Department. My sections are kind of our public health programs within the health department, and that includes healthy communities and where our Tobacco 21 program lives. This is, really important work, really important to, for community members, for the advancement of children and families in the long term. And one thing that brings me joy is summer is approaching.
Absolutely. Christina?
Hi, everyone. My name is Christina Latta-Landefeld. I'm the Chief Operating Officer here at Envision Partnerships in Butler County. Just real quick, we do lots of things prevention, almost all things prevention, but I'll say almost all things. And one thing that brings me joy right now is getting ready to start a PhD program at the University of Cincinnati in the fall.
That's awesome. And Megan.
Good afternoon. It's great to see all of you on today. Megan Folkerth, I'm Program Director for Health Policy and Systems at Interact for Health. And what brings me to this work is the policy and advocacy side of things. As a funder, we got engaged in the Tobacco 21 work early on, as we'll share, and have a passion for policy work and have worked in tobacco policy for quite a few years. And what's currently bringing me joy, I'm actually in Columbus today for a data symposium and 20th anniversary celebration for HPIO. And it's been really fun to reconnect and see some familiar faces, some former coworkers, and just connect with people in person.
I love that. And thanks so much for introducing yourselves in the chat. I love seeing what brings people joy, from getting active to grandkids to the weather, and lots of dogs. So dogs are featuring prominently in bringing people joy today, which is great.
Hi. Good afternoon, Kelly and everyone else. This is Wendy Hyde. I'm with the Preventing Tobacco Addiction Foundation, Tobacco 21. And I've been involved with Tobacco 21 in raising the sales age to 21 for about 7 years now, and have worked in numerous jurisdictions throughout the state to implement and tobacco retail licensing programs, and of course to enforce age of sale. And what brings me joy today is I am wrapping up the spring semester at the university in which I teach. So that's always a wonderful time of year as we wrap things up and look forward to a little bit more quiet time over the summer.
Absolutely. Love the transition into summer. Thanks so much, Wendy. Thank you all for being here. Now that we have our sort of chat fingers going, please continue to use that. Ask a question, make a comment, make an observation as we go along today, but please feel free to use the chat. So with that, I'm going to turn it over to Megan to dive us into policy and advocacy efforts.
Thanks, Kelly. So today we're going to use Tobacco 21 and tobacco retail licensing, that work, as a way to share the policy and advocacy phases, to talk about the full policy spectrum. So just want to ground us and root us in those policy and advocacy phases. You know, oftentimes when we think about policy and advocacy work, the majority of attention is given to the win of passing a policy, whether it's something new and big, like the Affordable Care Act, like T21, an increase in a budget line item, specific language changes in state policy, whatever that policy change is, seeing that hard work of advocacy efforts come to fruition is exciting for advocates and champions. But passing that policy really is such a narrow piece of a very complex and sometimes very long process when it comes to public policy efforts. So in reality, there's a ton of work ahead of time and ahead of the win. And then after the win, you know, that win is really just the beginning. So ahead of a policy being passed or even drafted, organizations, coalitions, and partners must come together, develop advocacy agendas, and from there, develop a policy. Developing that policy is a key step, and we must ensure that those policies include best practice and equitable language. So then advocating for those policies, we move from that policy development to policy adoption. But in that time between, advocating for those policies can take years. I think we'll hear a little bit across the spectrum today. You know, the Cincinnati policy in the grand scheme of policy change happened very fast. Butler County has been a little bit what I would consider more of a normal time frame for policy change. We had COVID-19 in there that slowed the process, but that policy development to policy adoption really can range from very quick to a very long multi-year process. And then Once the policy is created, there are numerous factors that shape and determine how that policy is implemented, how it's enforced, and ultimately the impact that that policy will have. So regardless of how well that policy is written, the implementation and enforcement is key. Some of these factors include the rules that are written, funding, capacity for local implementation agencies, and then there can be fights, which we saw at the end of last year, which we'll talk about a little bit of T21, but there can be fights around repeal, modifications, other policies that go back and undo some of the work that has been done. So just as in the case of the WIN, advocacy plays an important role throughout the life cycle of that agenda setting, policy development, policy passage, and then making sure that that policy stays in effect. Then we have policy evaluation, which we are going to highlight quite a bit today, because this is another important piece to make sure we are getting the intended impact of that policy work. So as you can see here, policy is not linear. Things are always changing. We have to have continuous ongoing monitoring so that we can ensure that our policies are still appropriate and being implemented and enforced with fidelity. So for our discussion today, we're going to walk through Tobacco 21 and tobacco retailer licensing as an example of the phases of our policy and advocacy work. So just to root us in the definitions of those policies, we have Tobacco 21, which is raising the minimum age of sale of tobacco products from the age of 18 to 21 years of age. And then the enforcement and implementation strategy is what we're referring to as tobacco retail license. So this allows for states and municipalities to comprehensively regulate all tobacco retailers, fund their enforcement programs, create penalty structures that suspend, revoke licenses for retailers if they continue to violate the policy. Next slide. So another thing to keep in mind is that policy efforts happen at all levels, whether it be local, state, or federal. And sometimes these efforts can compete with one another and definitely have an impact on each other. So you'll see from this timeline, we'll dig more specifically into Cincinnati on the next slide. But for this policy timeline, you can see that this includes both local, state, and federal policy efforts. So local policy efforts in Cincinnati for T21 started actually in early 2018, and the policy passed later that year in December of 2018. Again, this was a fairly quick timeline when we take all things into consideration. So when the policy was passed in 2018, a year was built in for implementation and enforcement. However, 6 months into that planning for implementation and enforcement, the state of Ohio passed Tobacco 21. So then the state of Ohio passed it, but they didn't include implementation and enforcement efforts in that policy. So then shortly after, Cincinnati passed tobacco retail license at the Board of Health level, and with implementation and enforcement set to begin in December of 2021. A few weeks after that was enforcement began, T21 was actually passed at the federal level. So while it was great to have this increased attention and policy efforts for Tobacco 21, the state and federal policies didn't include implementation and enforcement to ensure that they were being followed and having the intended impact. And then we also saw a lack of communication. And so there started to be some confusion among local retailers of what signage did I need to have up? What policy did I need to pass? What were the requirements for me? So communication about these policies is essential. And following that state and federal T21, communication in Cincinnati became extremely critical to its success. And then you see this glaring gap in 2020 and early 2021. I think we all know the COVID-19 pandemic significantly slowed policy progress. There wasn't appetite to focus on anything else. And so we saw significant slowing at our local level to pass these policies. And then in late 2021 and into 2022 and continuing now, we've certainly seen an uptick with Norwood, the city of Hamilton, and the city of Middletown passing local tobacco retail licensing. So then just sharing a little bit more detail on the specifics of the Cincinnati policy and other items that play in that same time frame. So along the top of this slide, you'll see the Cincinnati milestones, and then at the bottom, you'll see some other factors in the environment at play. Just to reiterate, Cincinnati was happening at the same time that state and federal policy were happening. March 14th of 2020 was the first order limiting public gatherings in Ohio, and that had an impact. And you'll see that, throughout all of this, Cincinnati had to continue on. They'd passed this policy. It was on the books. They had to figure out how to implement and enforce with fidelity. So the implementation and enforcement went into effect December 1st of 2019. And then we're going to talk a lot about our underage buy data, our implementation and enforcement data. And those processes actually started in between October and December of 2021. There was a little bit of slowing due to the COVID-19 pandemic. There was restrictions in place that meant that the health department couldn't go out and implement and enforce these policies the way it was intended. And so those external environmental factors have a huge impact on the policy efforts. So the city of Cincinnati passed a strong T21 and TRL policy. As you can see here, it's being compared to other local policies in Ohio, as well as other local policies across the country, and then the state of Ohio policy and the federal policy. But as we began this initiative and embarked with partners, we noticed that there was limited data and evaluation for T21 and TRL. So there was some data from the first policy passed in 2003 in Needham, Massachusetts, but beyond that, it was sparse, and there wasn't a lot to hang our hats on. When we talk about tobacco policy, smoke-free policy efforts have had a ton of data and evaluation over the years, and we just didn't have the same base for T21 and TRL. So given the strength of the policy locally and that lack of evaluation, we decided that we wanted to invest in a comprehensive evaluation of these policy efforts. And so I'm going to turn it over to Kelly to give the highlights of that, and then we'll dig in with the rest of the group.
Thanks so much, Megan. So Interact for Health brought on a fantastic partner to conduct the evaluation. I have to give a huge shout out to the Center for Public Health System Science at the Brown School at Washington University in St. Louis. Much of the team is on today. A huge thank you, Todd, Karen, Veronica, Jessica, and the whole team for all your work in this effort. So the purpose of the evaluation was to systematically assess the policy process and the impact, particularly of Cincinnati's Tobacco 21 policy and TRL program, while reviewing the efforts of other grantees that are working to advance Tobacco 21 here locally. Several methods were used. I want to give a shout out to the report you see here, and sort of if you want all the details, it is in there and on Interact for Health's website. But a lot of the data and information you see here came from key informant interviews with grantees and partners, a survey of realtors in the area, and follow-up interviews, which is often very rare in sort of the evaluation of efforts like this. And then a look at Cincinnati Health Department's enforcement data and hearing from youth and young adults. So with that, we're going to turn to a conversation about a case study of 2 jurisdictions, as you see here, and inviting all the presenters to sort of share the story of this work. And first, I'm going to turn it to, try to come off screen and turn it to Megan to kick us off. So from coalition building to policy passage, so you sort of laid out the initial stages of what it takes to change policy. But from that policy passage to implementation enforcement, you've been a part of it all, particularly in Cincinnati. So how did things get started in Cincinnati, and what were key facilitators for getting to that policy win, particularly so quickly?
Absolutely. So first, I would give a huge shout out. I know there's some other partners on this call that were part of that. I see Angelica and Amanda representing the American Heart Association, and they were certainly a key player in that. Cradle Cincinnati, the health department. We had a lot of great partners at the table. I will say it was more of an organization-led coalition. There were strong partners that had this desire to pass best practice policy, and we had stakeholders from various sectors. So we had the health department, we had hospitals at the table, nonprofit partners, policy and advocacy folks. And so that diverse group of stakeholders, I think, really helped elevate the issue, and people brought different points of view and different perspective to the table. We had clear roles and responsibilities for those partners. So what could partners do? Who could lobby, who could not lobby? We had our partners at the American Heart Association that are able to do that can register as lobbyists, which was a huge asset. We had a partner at Cradle Cincinnati that was very familiar with the policy process and could help us and had a lot of good relationships at City Hall. So getting really clear about who could do what and what those roles and responsibilities are. I think another strength of that group was setting deal breakers. What are we saying is the policy that we're going after, and what are we not willing to compromise on? So we were all on the table from the beginning. That way, whoever was having that conversation was clear on what the goal and intention was. And then from that strong coalition, we really worked on doing a policymaker assessment, which led us to identifying our policy champion at City Hall, who was really going to own this policy at the city level and was going to take this through the process, was going to be our advocate, was going to work with us to talk to other city council members. And so we had identified council member Denard, and she led that charge for us at City Hall. So we worked closely with her and her staff, as well as the legal department. The legal department would join our coalition meetings to talk through as they were drafting the policy changes we needed to make. And then the health department, I see Tanya on the call. Tanya and Denisha at the time were huge assets to the coalition, making sure we had health department buy-in, getting the Board of Health on board, making sure we could pass those regulations. So strong partners, strong relationships, I think are really what led the charge quickly.
That's great. Thanks so much, Megan. Let's move over to Butler County and Christina. How does the experience Megan shared differ from how the events unfolded in Butler County? If you could go back in time, what pitfalls would you avoid, or what do you wish you had known?
Yeah, well, we were very lucky in terms of where we entered this policy realm, because it was right after Cincinnati had passed. So we were able to get that information and sort of take it and distill it down to what was going to be best for us. What I would say, though, is going back from today, there were definitely lessons learned. Some of them include things like when the policy work, that win piece of it, when that happens, it doesn't mean that it's over. So we started off as aiming for Tobacco 21 as the policy change. So when that was passed at the state level and then the federal level, I literally, called Megan and was like, hey, so it happened, right? Like, we're done. Like, I don't know what happens next. She's like, no, we're going to continue going on because there's no enforcement as part of it. So it was a huge learning curve for me. And so that piece, was like lesson number one, which all of you just got in the last 10 minutes. If you didn't know that beforehand, policy work does not end. The other piece had to do with community education and what exactly that means. So in Middletown right now, and really across Butler County, everybody is saying, even with 2 cities having passed their tobacco retailer license, community education still needs to be at the top end of it, because even though we pulled in the partners that knew this was important, knew the policy change needed to happen and could make it happen because they were the governing bodies that set that into place, there's still a lot that the community doesn't know. And so a quick example of that, which has to do with another lesson learned, is what does that legislative body look like in each jurisdiction? So within Butler County, there's 2 city health departments, Middletown and Hamilton. Hamilton, this policy level change happens within city council. In Middletown, it happens within the health department. However, because the policy changed at the health department level, so that was passed, there's still a lot of community education that needs to happen at the council level within Middletown to help spread the word about what this is, what the impact is to the community, how it positively impacts youth and health outcomes for youth. So that's a big piece of it. It's just understanding what do the governing bodies look like? And then our eventual, I'm going to say it's going to happen, our eventual, full Butler County adoption of TRLs really is now into the nitty gritty of what does it look like in each township? What does it look like in those other cities that have the county health department as their, program director, so to speak? And then the last thing I would say is just understanding what the roles of the players are going into it. So we knew that youth always carry a very positive voice, right? Like that's going to help any kind of policy change happen, especially if it includes a legislative body. But understanding what is their role, where could it be the most useful? So for us, two things that were hugely helpful were to actually do environmental scans, have them go around the community and themselves identify, wow, there's this, Dollar General store on Main Street that is just littered with cigarette butts out front of it. That's something I'm going to identify as this is really not good for our community. The second thing is bring them to council meetings, bring them to those other meetings and allow them to talk. And that's fantastic. But then it's really understanding, again, within each jurisdiction, who are those movers and shakers? During 2020, we had all three health commissioners get together in February and we were ready to move forward. And then of course the world fell apart. But in Hamilton, in the health director or the health commissioner's stead was the planning director who stepped in a big way and said, I'm going to help carry this forward and move this torch forward. So it's understanding the different roles that people can have.
Yeah, thanks so much, Christina. I think it's really interesting to hear just in that snapshot for both you and Megan, just how there is a cadence and sort of how policy work, advocacy work unfolds, but it's unique to every community, and sort of hearing about how you navigated that, I think is a really interesting takeaway. All right, so we've talked just briefly around sort of that advocacy, policy development, moving into policy passage. Wendy, I'd love to turn it to you. Once a law is passed, then what? What happens? What are some of those key elements to implementation, and why does it matter? Why is it important for local implementation and enforcement?
Sure. So, I mean, first off, I guess we want to make sure we're all on the same page, right? An effective tobacco retail license, and what does that do? In 3 points, right? It holds retailers accountable, and it also provides a comprehensive list of all retailers and what that retail environment looks like in a community. We currently, under state code, state law, do not have a comprehensive list of all of our retailers for all of our products. So that comprehensive list is really important, and that's part of the enforcement and the implementation process, is getting that list of retailers together first and foremost. It also, an effective license allows you to revoke or suspend, as was mentioned earlier. So understanding from implementation process, what exactly is going to be for the community in which this has passed, what is going to be that accrual period in violation and penalty structure that's established. So that penalty structure oftentimes is established prior to the law passing. But then when it comes to implementing that piece of it, that can look a little bit different depending on who's doing the enforcement, and also what the powers of that community look like from an enforcement perspective, and whether on the violations are first violations, and the cost is also relatively important to think about. Also, when it comes to implementation, some key elements are who's going to be responsible, who's going to have the capacity to do that, who's going to be responsible from a health department perspective. Are you going to use your sanitarians? Are you going to use health educators? Are you going to use an outside agency to help with the implementation process and the enforcement piece for that piece of policy that you've passed? So establishing that is really critical as well. Other important piece of an effective implementation is educating the community. We've talked about that a little bit, but also educating the retailers. And, we want to make sure that that relationship between the retailers and the health department and the city continue to be positive. And so some of the retailers may not have a good understanding of what the minimum sales age is. And so educating them about how to educate their own clerks and the people that work for them and about what this policy looks like. Also educating them on the process that has been adopted to get their retail license, how they go about doing that, the annual fee, when that annual fee is due. All of those parts and pieces are critical for effective implementation. And we've seen that happen in the city of Cincinnati and several other areas throughout the state that have been passing these tobacco retail licensing policies. I will also want to mention from an implementation standpoint, it doesn't necessarily have to happen immediately after you pass the policy. So good implementation in that process can happen maybe 6 months later or a year later. It doesn't have to happen immediately. So you don't have to have all of those parts and pieces necessarily together right at the moment when you pass the policy, but there's time to build that in and to work towards that as well. I always try to encourage the communities I work in is, you know, if you have the political will to pass a policy now, right? And you may not have it in 6 months, depending on what changes from decision-making body, work towards passing that policy now and build in an extended period of time for implementation. Last piece that I want to put in that has been super helpful in several different communities is the piece about education, but community education in the aspect of prevention. So from a retail licensing cost perspective for retail, as many decision makers really appreciate it if you've put that money or allocate some of that funding from the retail license fees towards prevention and education in the community and in the school. So that's another way to kind of get that process put through decision makers, especially if you have some that are a little bit, you know, weary about passing a tobacco retail license as well. So the enforcement piece and implementation piece is critical to making sure that after you pass the policy that it's effective, and we can talk a little bit more about that in a few minutes if there's questions.
Absolutely. Thanks so much, Wendy. So I think in the city of Cincinnati, thanks to the Cincinnati Health Department, retailer education and outreach is something you all have worked on for several years, and sort of we'll share in a minute, this sort of feedback loop through the survey and the interviews with retailers and really bringing them in as a partner in the process is something that you all have done really well. So Dr. Amin, I want to invite you into the conversation and just hear from your perspective, why is it important to enforce policies? And if you can give us a sense of what enforcement looks like at the Cincinnati Health Department.
Sure. Good afternoon. So enforcement is really key to moving the law forward. So everyone so far has talked about the importance of the law and really the importance of what this means for our youth and for our future generations. So having the enforcement piece is really the ability to enforce that law, to hold those retailers accountable for what they're doing, and to have some way of compliance. And if we didn't have that law, likely the compliance would be pretty low, and there would be no way to show that we are making progress with this law. So I think that's it is really key. And we have both an environmental health specialist that goes out and will do the inspections, and we'll work with the underage buyers for the compliance component. And then we also have a public health educator. So I think it's working in tandem for the education piece, and as well as the enforcement piece. And I think in just a moment, we'll be sharing some of that data that's come out of it. That's, really exciting and really gives credit to how both of those come together and actually are showing success in the future. And I think, the importance of this law, again, is just for future kids. And we know that if we, do not prevent this at young ages, there could be certainly adverse health outcomes, quality of life issues as elderly. So it is really important to capture that now and to try to help the community in a public health effort. I would, since Tanya is on and she has been on the ground with this from the very beginning, if she would like to add something, feel free to do so.
Absolutely.
Thanks, Dr. Reed. Hey, everyone. no longer in my role at the health department, but I will say, as Dr. Amin was sharing, that enforcement has been critical in ensuring that we're protecting our young people in Cincinnati. And as Wendy shared, we really have to focus on that retailer education and building those relationships. And I think that is one of the most critical factors that has ensured compliance and maintaining that relationship with the retailers. So it's certainly been a learning experience all along.
Absolutely. We appreciate you, Tanya. So Dr. Amin, I'm going to invite you in to share about that local impact and what we've seen here. I'm going to reshare our slides now.
Sure.
All right.
Right. So as part of this assessment, we've been able to capture a really great way to look at the information over time and see what progress has been made. And this first slide is showing the response from youth and the ability to access tobacco products from the time that the program started to present. And we're showing actually a 27% decrease in the ability to access tobacco products, which means that, showing that this is working, that enforcement is helping, that the law is helping. And next slide just shows the difference between Cincinnati and other cities, very closely aligned with the ability to access between 37 and 35%. But that Cincinnati is doing really well in reducing the access to the youth and making it a bit harder to gain access to those products. Next slide. And this figure is looking at what happens when the inspections occur and where we're showing progress. So on the left, these are the underage buy attempts. And in 2022, there was over 150 checks by the underage buyers. And the number of inspections that have improved and passed is at 89%. So a great improvement in those that are actually staying in compliance through those checks. And then to the right is the inspection. So making sure that all the signage is appropriate and all the pieces that go into an inspection, those are at 71% in compliance. So I think, this just lends to the great work that the inspectors are doing, but also in partnership with the retailers, that they understand the policy and that they're following it. And this is the support. So I think this is really neat that the team was able to capture input from the retailers, and that the support over time has increased. And that's, thanks to our environmental health specialists that have really helped and walked through with the retailers when they have questions or if they need help with something, and not just saying, here you go, this is what you have to do and figure it out, but just helping them through the process. So support is at 66%. And this is the retailers experience smaller decreases in sales. So I think, initially when this started, there was great fear that this would interfere with the sales and with business. But what they've seen is that it actually hasn't increased very much, decreased very much. And the businesses are still able to be in compliance and also, be held accountable for the requirements of the policy. And that the support has actually increased from the community, and it's increased by about 16% from 2018 to present. So I think, again, that just lends to the positive response through a lot of hard work and education that's coming from partners and our team.
Thanks so much. I think that's a helpful overview. Again, I'll plug and I'll send a follow-up email after this with links to everything, but the full evaluation report, a summary, and then a policy impact brief that Washington University put together is on Interact for Health's website. So you can go into the details of all of this work. And I think what's really interesting about the impact piece is a lot of what we tried to look at was who the policy affects. So our youth, our retailers, they're affected by it. So how do we bring them in, even through the data collection, into the conversation and into sharing ongoing feedback? I think was really powerful through this evaluation. I'd now like to invite Wendy in, if you can talk to us a little bit about, so what is the future of, what are the implications of this work on tobacco policy and policy change in general?
First of all, I want to say I'm absolutely amazed and with the work that's been done in Cincinnati. It's fantastic, and it has really allowed us, from the perspective of our agency, to have that data and that evaluation that we can then share with other health departments and other communities throughout the state and on the national level, frankly. So kudos to Cincinnati and Interact for Health and the work that's been done. As far as what's happening in the state currently, I will say there are 20 total tobacco retail licensing communities throughout the state right now. And these are TRLs that are best practice tobacco retail licensing with good enforcement and a penalty structure. So that's really exciting for us as an organization to see how this has just bloomed in the last few years. We also have 12 other communities that I consider that are in the queue. They're somewhere along the potential for policy adoption, hopefully within the next 6 months to a year. So 32 communities for a tobacco retail license would be really good. And then just to continue to move forward from there. And really the reason why tobacco retail licensing is so important and why we want to continue to pass this at the local level is because it'll help us to strengthen the need for effective enforcement, potentially at the state level, if we get to that point where we can have effective enforcement from a state level perspective. So that's the overall goal. Even when we passed 21, we had over, I think there were 32 cities in the state that were already had already raised the minimum sales age to 21 when the state initiated that to 21 in 2019. So it's super important. The more local action that we can have certainly strengthens the conversation at the state level as well. So that's one of the main focuses. Additionally, when it comes to tobacco retail license, other important parts and pieces is that you can use it, of course, to effectively enforce age of sale, but you can also use it to completely determine what the retail landscape looks like within your community. So you can add provisions that look like a maximum number of licenses. So in other words, you can cap how many tobacco retail licenses you want to have allowed within your city or community. You can also add proximity to other retail licensed retailers. So maybe you don't want, a retailer to be too close or within a certain limit of another retailer, or of course, restricting youth access to youth access facilities as well, and limiting that. So a tobacco retail license allows you to determine that. A license also allows for things like maybe pharmacies would become ineligible for licenses within that community. So that's an additional piece. And of course, one of the sometimes more difficult additions, but we are seeing some progress there as we have in the city of Columbus, is prohibiting the sale of flavored products and restricting any sale, or if there is going to be any of those flavor products for sale within a local community. So it's very powerful. A tobacco retail license is very powerful at the local level because you can add these provisions on in a way that makes it much more difficult for the industry to find a loophole in that ordinance or in that retail license. And then, of course, I would be remiss not to mention what happened last fall at the state level as far as preemption goes. Many of you are aware perhaps on this call that last fall, the state legislature was unhappy with the passage of a flavor ban in the city of Columbus and tried to preempt any future local work, and it would also undo all of the good work that we've done at the local level. Fortunately, the governor vetoed the bill that would have restricted any local work from being done. However, we know that there is certainly a potential that this will be reinvigorated at some point in time within the next year at the state level. And so the more tobacco retail licenses we have passed and the more local laws we have passed in the state or throughout the state, the less power, I guess, or less likely that the legislative bodies would be in favor of restricting local work from happening effectively. So that's a couple important points to recognize. Also, working locally, I do have to say, as opposed to the state level, at the state level, this past year alone, there were $884.6 million that were generated from the tax revenue of cigarettes, OTPs, and vapor products at the state level, which makes it challenging, right, to pass effective tobacco retail licensing and or any other type of tobacco retail work at the state level, because they don't want to lose that tax revenue. So when we work locally, we can gain the same protective factors for our communities, and it's a little bit easier, of course, to pass those policies and to become more effective from an enforcement standpoint. So that's where we are today at the state of tobacco here in Ohio. And again, the more we pass locally, the less likely we're going to give them the power of the state to refuse us to work locally. So thank you.
Thank you so much, Wendy. We're going to move on to questions. And I know we have one in the chat from Caitlin. Do all realtors have some sort of underage buy attempt every year on top of general inspections? I don't know, Dr. Amin, another presenter, or you're welcome to turf it to Tanya or anyone else if you want to touch on that. Sort of, how does it work? Like, what is the cadence for underage buy attempts and general inspections, if you can speak to that?
Yeah, for the underage buy attempts, it's twice a year we bring them on. But I can let Tanya, if she wants to give a little bit more feedback on the day-to-day process.
Sure. So in answer to your question, Caitlin, there are 2 inspections that each retailer receive annually. One is the signage inspection, as it's called, where environmental health specialist goes out, make sure that they have their license, their signage is properly posted. And then the compliance check is the underage buy attempt. That's done annually as well, under the supervision or under the oversight of the environmental health specialist. The health department brings on young adults ages 18 to 20 for a period of about 6 weeks or so, and doing that 2 to 3 times annually. So in chunks of time, we'll have them working with the health department to conduct those.
And then just in Butler County, to answer that real quick, because we have one city that's been, 2 cities that have been passed, one that's been implemented, the other one we're sort of in that gap time, that there was about 3 months between it being sort of enacted and then the retailers having to have their license and all of that. And there was a lot of other activity that was going on. And so there were some underage buy attempts that happened, really that it was the police department that was getting that going. And what I can share is that within the first week of retailers having to really follow the licensing rules, there were 4 retailers that got caught selling to underage. So what's written in is that we have to do underage buy attempts about once a year. So we're aiming for about once a year. And again, that's sort of a spattering. And then we're trying to make sure that within the county that all of our license language is the same or as similar as it can be. But I think that what happened in the beginning through the police department at the city level was really helpful. And it just has been really interesting to see what's happened with the retailers and their response to that. But we also were at 100% compliance within that first month in terms of having their license. So I know that in other jurisdictions, it's taken a little bit longer, and there was some concern from the health commissioner that she wasn't at 100%, within the first week, but it was within the first month. So every place looks a little different.
Thanks so much. And again, feel free to drop a question in the chat, and/or if you feel comfortable to come on video, you're welcome to join us in the conversation and chime in that way. And while that's happening, Wendy, do you want to chime in?
Yeah, no, I just wanted to share something that we didn't talk about today, but is also what communities are doing throughout the state, are passing moratoriums on any additional vape shops or smoke shops coming into their community. Maybe they're not quite ready yet to pass the tobacco retail license, or maybe the license process is taking a little bit longer, but they want to be able to do something immediately. And passing a moratorium at the city level is super helpful. It helps to kind of set, a baseline, and to say, hey, you know what, we're going to move forward in 6 months or a year. But meanwhile, we want to do something now because we know that this landscape is harmful to our community and our kids especially.
We'll pause to see if anyone else has a question, comment, experience to share. I was curious, Megan, I was going to turn it to you. So we, talked a lot today about Tobacco 21, tobacco to retailer licensing, and what goes into that. But what's the so what for future efforts, for other great advocacy and policy work that's happening here locally? Do you have any comments on that?
Absolutely. So I think, to hit on some of the things that we highlighted throughout the webinar that I think apply to all policy work, it's really getting the right partners around the table, identifying those roles and responsibilities early on, what those deal breakers are, being really clear on the policy that the group is going after. I think, policy work cannot be done in isolation. It's no one organization's responsibility. I think most good policy work happens with the collaboration of partners. I know Kelly hit on this as well, making sure you involve those that will be most impacted by the policy and centering those people in the conversation. So it would be really easy, for example, with this T21 TRL work to ignore the retailers and say, we don't care, they're making money off of this, we just don't care. But it's important because we're relying on them to implement and enforce, and we're relying on them to follow the policy. So we need to understand their perspective. We need to understand what their concerns are so they can be addressed. And I think that is something that Cincinnati Health Department did a phenomenal job of. And I know the jurisdictions in Butler County have been reaching out to those retailers as well. So I think it's just really important to keep in mind who's impacted by the policy, how you involve them early and often in that conversation, and then stay the course. The policy work is long-term. I think Butler County is a testament to this. It would have been really easy to stop during the COVID-19 pandemic, and Butler County kept at it. They reached out, what can we do? How can we keep this going? How do we keep educating? So understanding that when we're doing policy work, there's this additional environmental context that we have to take into account, and it's going to have an impact. And it's how you respond to those environmental factors, how you roll them into the fold of the work, and how you continue to move forward. So it's long-term work. You have to stay the course. You have to be involved for the long term, and understand that, the win is just such a small piece of the bigger picture.
Thanks so much. I think for our last couple of minutes, Christina, Wendy, Dr. Amin, anything that went unsaid or any other final comments that you want to leave us with today, and then we can move into more informal continued Q&A. Awesome. Well, that wraps us up for sort of the formal presentation. I'm going to stop the recording, but again, invite anyone who's interested to stick around and chat with us. Thank you so much for joining today.